Hi everyone, welcome back to my YouTube channel and today we are going to talk about acute inflammation. So let's start our topic with introduction. Acute inflammation is the immediate and short-term response of the body to harmful stimuli such as infection, injury or chemical irritation. It is a protective mechanism that is designed to eliminate the cause of cell injury, to remove dead tissue and to initiate the process of healing. Unlike chronic inflammation, it is rapid in onset and usually lasts from a few minutes to few days. Definition of acute inflammation. Acute inflammation is defined as early vascular and cellular response of living tissue to injury. It is characterized by fluid exudation, migration of leukocytes, mainly neutrophils, and the release of chemical mediators. Causes of acute inflammation. First is infection. That may be bacterial infection, viral infection, fungal infection, or parasitic infection. Second cause of acute inflammation may be physical agents. Agents that may include trauma, burns, radiation, or frostbite. Third cause may be chemical agents that may include toxins, irritants, venoms, and acids. Fourth cause of acute inflammation is immune reaction that may include hypersensitivity reactions and allergies. Fifth cause may be ischemia and necrosis, that is, lack of oxygen supply to the tissues. Cardinal signs of acute inflammation. First is rubor, that is also called as redness, and it is due to increased blood flow. Second cardinal sign is calor, that is also called as heat, that is from vasodilation and higher metabolism. Third cardinal signs of acute inflammation is tumor, that is also called as swelling, that is from leakage of fluid, and it is also called as edema. Fourth cardinal sign of acute inflammation is dolor, that is also called as pain, and it is due to pressure and chemical mediators. Fifth cardinal signs of acute inflammation is punctuliosa, that is also called as loss of function. It is due to pain and tissue damage. Now let's talk about vascular events that occur during acute inflammation. First event that occur is vasodilation, that is when arteries and capillaries widen, causing redness and heat. Second thing that occur in vessel is increase of permeability, that is when endothelial gaps form in the vessels and thus allow plasma protein and fluid to leak into the tissue. Third vascular event that occurs is stasis, that is, blood flow slows at the area of acute inflammation, thus allowing leukocytes to move closer to the vessel's wall. Now let's talk about cellular events that occur during acute inflammation. First is leukocyte recruitment. As there is margination of leukocytes or WBCs or white blood cells move to the periphery of vessels. Then they start rolling and adhesion to the endothelium occur. Then there is diapedesis of leukocyte, that is migration of leukocyte through the vessel wall. Second cellular event that occur during acute inflammation is chemotaxis. That is when the white blood cells move towards the site of injury guided by chemical signals. Third cellular event that occur in the acute inflammation is phagocytosis. That is when neutrophils and macrophages engulf and destroy microbes and debris. Chemical mediators in acute inflammation. First is histamine. It causes vasodilation and increased permeability. Second chemical mediator is prostaglandin. It is responsible for pain and fever. Third chemical mediator is cytokines. It may include interleukin 1 and tumor necrosis factor alpha that promote leukocyte recruitment and fever. Fourth chemical mediator in acute inflammation is complement system that enhance phagocytosis and cell killing. Now let's talk about types of acute inflammation. First is serous type, that includes watery fluid. Second is fibrinous type of acute inflammation, that include fibrin-rich exudate, for example pericarditis. Third type of acute inflammation is purulent or suppurative inflammation, that includes pus formation that is due to neutrophils, for example abscess. Fourth type is ulcerative inflammation or ulcerative acute inflammation, that is when local surface defect is there due to tissue necrosis. Outcomes of acute inflammation may be resolution, that is complete return to normal tissue. It may be suppuration, that is pus or abscess formation after acute inflammation. Third outcome of acute inflammation may be fibrosis or scar formation. It occurs when tissue damage is severe. Fourth outcome of acute inflammation may be progression to chronic inflammation. If it occurs if injury persists after acute inflammation, then it progresses to chronic inflammation. Conclusion of this lecture video. Acute inflammation is a vital defense mechanism that protects the body from infections and injuries. It is characterized by vascular change, leukocyte migration, and 5 cardinal signs. While essential for healing, uncontrolled acute inflammation can cause tissue damage, highlighting the importance of proper regulation. And this was all about acute inflammation. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.